understand. I'm not sure which are the most effective.
To go see your patients. Thank you.
Thank you so much. I'm really sorry about that.
Oh,
but I
that's
do
all
have a
right.
Full afternoon of patients.
Well, he led right into it, so it worked out.
Can you all hear me with the mask on? Great, thank you. So first off, thank you so much for inviting me here to speak today. I'm Debbie Greenhouse. I'm a pediatrician at Palmetto Pediatrics here in Columbia. I'm a past president of the South Carolina chapter of the American Academy of Pediatrics. And I'm speaking on behalf of the American Academy of Pediatrics and the South Carolina chapter today. I'd also like to give credit to Dr. Anna Catherine Birch, who is one of our pediatric infectious disease doctors at our children's hospital here in Columbia, who helped me with some of the data that I'm going to present to you and also stands very strongly behind the comments that I'm going to make. So, after weighing the information that we currently have about children and coronavirus, along with the information that we have about the negative effects of school closures on children, the American Academy of Pediatrics strongly recommends that the goal that what we're working towards should be to have children physically present in school, and that this needs to happen with very careful measures to keep students and staff safe, and also to have the flexibility to adapt as needed to the community's prevalence of COVID-19, as Dr. Spearman said. I first want to recognize that everyone's fear of reopening in the time of COVID is valid, but there are specific facts about the pediatric population that need to be guiding our decisions to do what's best for children in South Carolina. The scientific evidence that we have thus far indicates that children and adolescents are much less likely to have significant symptoms or severe disease resulting from COVID infection. Studies have also shown that children are less likely to become infected and also less likely to spread the infection, an important factor when considering the safety of our teachers and our staff. COVID-19 appears to behave differently in children and adolescents when compared to other common viruses such as influenza. We also know that the primary mode of COVID-19 spread is from person to person, mainly by droplet transmission. Thus, strategies to minimize the transmission, such as physical distancing, face coverings, and hand hygiene, can significantly decrease the spread of this disease. To cite a few really important examples in support of this, there's a local cheer gym that opened May 18th with children from ages 3 to 19 practicing 5 days a week. There have been no known infections to the children or the staff in that gym. In our own children's hospital here in Columbia, from October 2019 to the present, we have treated 13 patients, inpatient and emergency, with COVID and 592 with influenza. Nationally, there have been 12 known pediatric COVID deaths versus 185 flu deaths in the same time period. And here's something else that we know about children here in South Carolina, which you've heard already. The number I had was currently over 16,000 children are unaccounted for. Apparently it is lower than that, which obviously is really good. This is would be now a little under 2% of the population of children in our public schools. And there is a socioeconomic disparity among the missing children. In Lexington-Richland 5, a wealthy district, only about 0.8% of the children are unaccounted for, compared to 11.3% in Hampton County District 3 and 11.1% of children in Jasper County. This socioeconomic disparity will only widen if our children are unable to attend school in the fall. The current plans being introduced or suggested in some of our school districts, which rely heavily on distance learning and offer only very limited in-person instruction for middle and high schoolers, will result in dramatic widening in that socioeconomic gap in education among children in South Carolina. These plans also result in huge logistical and financial barriers for the parents, who may not be able to maintain their jobs if the children aren't in school 5 days a week. The current estimate is that we are at risk of losing 14 to 18% of the South Carolina healthcare workforce if the children aren't in school full-time. The parents won't be able to work. Even more important than those financial and logistical issues to the pediatricians is this. The mental health impacts of school closures and remote learning have been devastating for South Carolina children. Lengthy time away from school often results in social isolation. Every single pediatrician can relate stories now of children with anxiety, depression, and suicidal thoughts related to social isolation. I personally have never seen the level of mental health problems that I'm dealing with right now related directly to school closures. I've never before had children say in my office, "Please, Dr. Greenhouse, please help them figure out how to open schools again. I want to go back to school. I heard that 4 times this morning. I had 2 suicidal patients in my office in the last 24 hours. I'm not talking about teenagers anymore. This isn't just suicidal teenagers. This is 8, 9, 10-year-olds now saying they don't want to be here anymore because they're so isolated, that they don't feel they have anything to live for. And these kids understand what that means. We have to take that seriously. School closures also create a major issue for children at risk of abuse and neglect. DSS reports in South Carolina were down nearly 40% in April 2020 compared to the same time period in 2019. That's not a good thing. It doesn't mean that fewer children are being neglected or abused. It simply means that no one is there to notice and to report it because the children aren't in school. It means that the children are actually in greater risk. The same issue exists for children dealing with food insecurity. If the children have fallen off the radar, they may not be receiving the healthy food that they need to grow and be able to learn. The AAP recognizes that there are many challenges associated with opening schools this fall. As a result, we have created a guideline statement that I've distributed to all of you that outlines the steps to take to try to minimize the risk of COVID spreading in the school setting. There is no way to completely eliminate that risk, just as there's no way to completely eliminate the risk of flu, strep throat, any other infectious disease circulating in our schools. The major interventions include that children in pre-K should spend time outdoors as much as possible. Hand washing and cohorting the classes are important, and adults working with this age group should be wearing cloth face coverings. Children in kindergarten and first grade should wear face masks when they're on the bus, when they're walking into school, when they're walking into hallways. Not feasible for those kids to be wearing face masks all day long. It won't work. Older children should wear face masks throughout the day, but they should have mask breaks when they're able to be distanced. Current data suggests that a distance of 3 feet in school is adequate if the children are wearing masks. Other countries, including the UK, are actually adopting the 3-foot distance as a standard in schools, and they're doing well. The desks should be 3 to 6 feet apart. The classes should be cohorted as much as possible, and the children should be outside as much as possible. Secondary school children should be using cloth masks if they're not able to stay 6 feet apart from one another. The desks should be 3 to 6 feet apart again. The students should avoid close contact, should be outdoors when possible. The teachers should be rotating in classes rather than the kids whenever that's feasible. Everybody should be washing their hands a lot, and hand sanitizer should be available. And then the adults in the school, and this is really important because the disease is more likely to spread among the adults versus from the kids to the adults. We just don't see very much spread from child to adult. So the adults should maintain 6-foot social distancing when possible, 3 with the kids, wear face coverings, and they should be washing their hands frequently. Meetings should be held virtually. They should not be having group staff meetings in person. Parents should be discouraged from entering the building. And then congregating in shared spaces such as staff lounges should be discouraged. The school buses, the capacity can be increased above 50% if the children are wearing masks. The windows should be kept open when possible. Here in South Carolina, a lot of the time we can do that. The seats should be assigned. Family members, if they're on the same bus, should be together. And hand sanitizer should be used when the kids are getting on the buses. The driver should have face protection. Really important, immunization records should be checked carefully because many of our kids have fallen behind on their immunizations during the pandemic. Children who qualify for free and reduced meals should receive those meals regardless of whether they're attending in person or attending virtually. And also really important, children with special needs should have their individual education plan, their IEP, reviewed to be sure that their accommodations are in place and that services are initiated, even if that's being done virtually. And then also really important, the schools need to be prepared to deal with the wide range of mental health needs that are going to present when school reopens, whenever that happens. So the most important thing to remember from a pediatric perspective is that this is a very fluid situation. The school districts are going to have to be continuously monitoring the pandemic in the state and in their district and making changes as the situation requires. The goal, as the AAP states, is to have the children return to school in as safe a way as possible for the students, for the teachers, and for the staff. For those families who don't wish to send their children to school this year, and I've heard from plenty of those, and who feel that they can provide for their education at home, that's fine. And that's an option that has existed in South Carolina for some time. But for the rest of South Carolina's children, the goal simply must be to bring them back to school. The kids are depending upon us to find a way to do that. Thank you again for allowing me to speak to you. Happy to answer any questions.
Thank you. Senator Alexander.
Thank you, Madam Chair. And thank you for being here first and foremost, and for you being a partner with our superintendent and the schools from that standpoint. And it's refreshing to hear those guidelines that I'm sure they will be working with you from that standpoint. You've heard the conversation we've had about these students that we've not had any contact with during
Yes,
that
sir.
period of time. Is there a way, maybe there's not an answer today, but is there a way, or if you could be putting some thoughts into this as to how y'all could partner? I know we've got HIPAA and things of that nature that we have to contend with, but is there a way that if we've got students that are having that interaction with y'all that maybe is not being interacted with the school district, that there's a way that you could assist us in trying to identify these children from that standpoint?
Absolutely. I think that the pediatricians in South Carolina would be happy to partner to try to track down those children. We have a quality improvement collaborative in South Carolina called QTIP. It's 31 practices that work together on quality improvement projects. I guarantee that collaborative, we would jump all over that to try to help find those children.
Well, if I would say that I know in my area, Oconee and Pickens County, I've been very involved with pediatricians there, and they do a lot of wonderful programs, very
Wonderful folks up
proactive.
there.
The reading program is certainly another great example that they've been involved in. So I look forward to us all working together, and thank you again for being here today.
Absolutely.
Senator from Richland.
Thank you, Senator. Dr. Greenhouse, I want to thank you for being here today. I have been trying to read as much as I can on this issue because I'm getting contact from parents who want their kids to go back and a number of parents who don't want their kids to go back. So you would agree at the outset that that should be a parental decision,
Absolutely.
that there ought to be options presented, and no parent should be made to send their child to school if they feel that that's dangerous.
Absolutely not. That there absolutely should be an option.
So we were handed just a moment ago by the Education Department a metrics and categorization showing, what the infection rate is by county, the blue being awful. We were told a moment ago we're third in the world in terms of infection rates. But you basically said kids don't get it, don't spread it. So that
They do get it. Typically, when we see a child with it, and this is almost every kid that I've seen, it's two categories. The first category is the child who catches the virus from a symptomatic household contact. In other words, sick parent or sick grandparent gives it to child. Not the other way around. Child's not giving it to parent. Child typically is not giving it to grandparent. The other category is your older adolescent hanging out at the bars, hanging out at the beach, hanging out at indoor restaurants, places like that.
So what's the top end age you would say would be less likely to spread it?
Well, that is largely depending upon behaviors. Certainly through middle school, you're not likely to see a whole lot of spread.
So what's your, and I know you got places to go, so I'm going to sort of cut to the chase here. So you're saying that we should do a construct that allows elementary and middle school kids to go back 5 days a week?
I would say absolutely. My ultimate goal would be all of the kids, including high school, because your high school kids, you can get them to wear a mask, you can get them to socially distance, they understand. Can you get them to not go to the beach and all of those things? Of course not. I've had teenagers. I understand that.
But they're more likely to get infected, and they spread infection. An 18-year-old can spread infection just like a 50-year-old.
We've had lots of cases where, and again, those kids are not usually getting particularly sick, but they absolutely can spread it. So my one editorial comment would be that if I think there was one other thing that we could do in South Carolina that would really help us, it would be closing the bars.
Oh, that's really good news for me. Perhaps you could talk to Governor McMaster about that, please. And in all seriousness, these places where kids gather, because an 18-year-old thinks they're going to live forever, they're not worried
Absolutely.
about it, and they're not worried particularly apparently about spreading it to anybody else. Those are hot spots for
Yes.
spreading this virus. But let's get back to the kids in school. So you're saying if we could open up our schools 5 days a week, for let's leave high school alone for just a minute, elementary and middle schools, you do that today.
Yes, I would.
And from a health care professional, you think that poses little or no risk to those kids?
Oh, I would never say no risk. Life is a risk in general. Crossing the street is a risk. There is always some risk, but I think that if we do this smart and if we follow the precautions that have been outlined in the AAP document, we can keep that risk as low as possible, and then we have to continue to keep an eagle eye on what is going on.
Well, and you would agree with me if you look at not the best, most wealthy school districts in the state, many of the school districts won't have the resources to meet many of these requirements, correct?
No, actually, they should. Most of these requirements are not things that cost a lot of money. I think, honestly, the financial requirements will be greater if we keep the schools closed,
Okay. Well,
as far as having to supply the technology and all those things.
Okay. And we've got $600 and something million we could help with, apparently.
I do, but I do also think, another editorial comment here, that going forward, to get to the best point that we can be in before the schools start back, like I said, closing the bars makes a big difference. I think we're already seeing an impact from mask requirements locally. A statewide mask requirement, I think, could go a very long way to help us as well and to help all of the schools be able to get there.
So I could quote you saying that if I talked to Governor McMaster, closing the bars and a statewide mask requirement would do dramatic good in terms of
Absolutely.
our being able to open the schools. And as a physician, you're telling me
My top three would be closing the bars, a statewide mask requirement, and closing indoor dining for a while. And I appreciate so much you letting me get that out there and say that, because
no,
there's
it's
no
important.
question it makes
It's
a
important for us to hear that from a healthcare professional rather than a politician. Thank you.
Here, and it's very interesting. I don't mind saying, I guess I'm just in the minority. I'm just really afraid of, even though I hear what you're saying, of opening schools, mainly because just the way our numbers are just skyrocketing. And I know we're talking about students, and I've talked to many parents that probably are not going to feel good about sending their children back to school. But the other thing is that we have a lot of adults, talking about teachers and cafeteria workers and custodians and the like. Some who are elderly and some who have underlying health issues. And I think we have to consider that also. And I just, I hear everything that's being said, but I don't mind being alone. But I think unless we see some type of a change in statistics or data or in these numbers, I just have a feeling that I'm not, of course, a medical professional. I just have a feeling that it's going to be a recipe for disaster, because what's going to happen at some point, some of these folks are going to start getting sick, and people are going to panic.
Well, some of them will get sick, but that
Yeah.
doesn't mean they got sick from anyone in school.
I understand. But I mean, when they go back to school,
Sure.
if they get sick, it's going to be hard to make people think they didn't get sick. But I understand what you're saying. I'm one of the ones that think that that our numbers are as they are. We're setting records once a day a week. We're getting new records, because I do feel like we probably open things back up too soon. And I think that there's a danger that we may open schools back up too soon also. I really would love for our students to go back to school and normally, but these are just not normal times. And I'm one of the ones that's willing to wait until things appear to be more safe, or there's a vaccination, or numbers are declining like they have in places like New York or whatever. So it just scares me, the thought that we would contemplate sending kids back to school under these conditions, although I appreciate and understand the information that you gave us, and I'm speaking for more than just myself.
And I totally understand that, and I've absolutely heard from parents who do not plan to send their children back to school, and I think that is absolutely fine. And there absolutely are employees who probably shouldn't be going back right now, who are elderly or who have significant risk factors. That is the same in my profession as well. There are some physicians who should not be seeing patients right now for the same reason. But I do think that we have to look at the risk of opening the schools versus the risk of keeping them closed. And there are major risks of keeping them closed. Like I said, these suicidal 8 and 9-year-olds, if we don't open the schools, some of them will succeed. we can talk every day about making sure that every firearm in the house is locked up and making sure that all the pills are locked up and all of those things. But some of those children are going to succeed if we can't get them back in school. So it's a trade-off. There's no win-win situation here, and it is fluid. And I am praying every night that these rates drop, and I am praying that the masks make a difference, and I'm praying that South Carolinians as a whole can make good decisions, and that our behaviors can change to adapt to this, because that's what it's going to take at the end of the day. It's going to take citizens doing the right thing, and then we can fix this, and then we can open the schools without any problem.
Thank you, Madam Chair. And Doctor, let me thank you and join the chorus and for those that have already said it, and congratulate you on your well received testimony here today. And I agree with you, and I couldn't agree more that it's important for the young people to end up being in school. We complain so many times about the social aspect of children not being able to be with other children, and obviously that's a thing that people do a lot of times. They labor between homeschooling, skipping grades, all that kind of stuff. I've had it in my own house as to what happens to a child. But I think what I'm hearing you say is that, one, that it's time for us to end up stepping up and to be leaders, and to say, one, and Senator from Clarendon, I think what you are helping us say too is that we don't want to draw a line and says nobody goes back until this virus goes down. We just can't do that.
And honestly, we can't say that we're going to wait for a vaccine, because we really just don't know.
All the reports that I'm hearing, and you maybe educate us, is that I just saw $1 billion some odd went to a group in Maryland, and they're talking about early sometime next year.
That's the earliest that we are hearing. But vaccine science is a funny thing. You can't predict it.
And plus, you got to have the trials and the human
Correct.
component and that kind of thing. And so what I think that we should be able to do, and you can help us with based on your medical expertise and background, is we should get our superintendent, who has given us guidelines, and we're issuing guidelines to the district. But I think that more so with emphasis, districts, open your schools up to these young people. Okay. Here's some guidelines we'd like for you to end up having, but the directive is to open the schools up so that we can end up making certain that we can use, based upon the backdrop of the medical expertise that we end up having, and giving them an opportunity to end up, if you don't want to do it, understand that you can make your decisions. Absolutely. You can end up doing it virtual. But I think that if we just give them guidance and say, this is what you'll do, local school district, because we empower local school districts. Say, this is what you'll do if you open it up. This is what happens. Then I think that we have a apathetic or maybe a complacent kind of approach toward doing it. And I think that particularly with the young people, that we have to end up, Madam Chairlady, with the backdrop of this able doctor, to say, we need to be able to support our superintendent and to go back to the districts and say, this is what happened. Now, I understand the other aspect, what the Senator from Richland is saying, is that, we also probably got to end up saying, well, she also said the caveat is that we need to, wear these masks.
Absolutely.
And so the thing is that if who was that? You're not old enough to remember that Mickey Mantle said that if I knew I was going to be this old, I'd have taken better care of myself. Well, we have to end up taking care of ourselves now, in the fact that children may not get it as prominent as adults. We got to end up preaching the wellness, and it's not political independence and all this kind of stuff not to wear a mask. We're just talking about the safety of our citizenry. But I'm really just caught on this thing with these children that we're losing, and it's problematic. And I'm encouraged by your testimony, and I hope that we take heed and we take this back to our full committee, take this back to the Senate, and take this back to our budgetary matters in September, and also help our superintendent to end up saying, guess what? We got your back. Let's go to the school districts and say, this is what we need to end up doing. We got those that have 0 that we've contacted. Let's go and find the ones that those and end up giving some help. And also that we can have a way to put our emphasis together to say, one, let's get the kids back in school, face-to-face with their teachers, parental decision to end up having virtual learning. We got medical expertise and others here, and maybe she can come back and talk to some of our folks over at DHEC as well to understand this is what we're seeing from our standpoint, and we can have this as something that we can end up presenting, and we're going to watch the numbers at the same time.
Happy to do that. I will also tell you that the South Carolina chapter of the American Academy of Pediatrics is an incredibly cohesive group, and we are all behind this. And I guarantee we could find folks in every school district that would be more than happy to partner with the districts. I've worked with Richland 2's Health Advisory Council since before my children were born, and my kids are now in med school and law school. And we've got folks like me in all of the districts. We can identify them, and we can get them involved and get them helping as we move forward with this.
But I think also it has to be a collaborative effort from our standpoint with South Carolina Department of Health and Environmental Control, so that because we're getting directives and information from them, and then once we have all that information, I mean, the people that know the least about it are people like me, and so I'm trying to be here and to be a sponge to see what is going on. But what I do know is that the elementary things, that if a child is not getting it now, then it's going to be a problem.
Thank you very much.
I know you've got to go back to work, so go take care of those patients.
I appreciate
We
the
appreciate you.
opportunity. Thank you so
Thank you.
much.
Thank you.